So Farber disease is currently an untreated lysosomal storage disease that results from a deficiency in the enzyme acid ceramidase that results in the accumulation of ceramides, which are inflammatory or pro-inflammatory and potentially neurotoxic. So there is a need to provide a therapy to these patients to reduce the levels of ceramides in them and replace the enzyme deficiency. We're often asked the prevalence of Farber disease, and the general consensus is that Farber disease is not that prevalent. In fact, it's quite rare. And while we don't have strong evidence to argue against the rarity of it, in fact it is a rare disease, we do think that the prevalence is significantly higher than what is currently believed. The literature reflects a 1 in a million prevalence, which would then mean that a clinician would see a patient with this disease maybe once in their career. But we do have a growing body of data and recent work to suggest the prevalence is significantly higher. In fact, there are a number of cases of patients presenting rather young in life with pain and not progressing to have some of the other cardinal symptoms, which would be the nodules or a hoarseness in voice or arthritis or contractures, those being the cardinal symptoms. So there are cases of patients having pain and not having these cardinal symptoms, and then living for quite some time without a diagnosis and without even progression of the disease. And then we also are aware of patients that may be significantly older and still potentially undiagnosed that are considered to be with severe arthritis. And so with that, I would make the argument that the prevalence could be significantly higher, and there's considerable work to be done to identify these undiagnosed patients.